وعليكم السلام. How are you? وعليكم السلام سيد المدير. أنا إبراهيم بندور. تمام الحمد لله. كله تمام كله تمام. أنا جوك. أنا كله جوك.
Okay. No, first of all, thank you so much. I'm glad that I'm glad that the President actually proposed that I visit this center, Sudan Medical Specialization Board, Smsb. Yeah. I'm very, very passionate about human resource specialty work because that's the major pillar of any system, be it health system or other systems. It's just the human capital or the asset. I mean, the asset is the human resource, the major one. So investing in human resources is very important. And many countries are struggling. And there is a huge gap globally, already 18 million, as you know. Although the gap is huge, many countries I visited, they don't have big or ambitious plan like yours. Without ambition, nothing can happen. So I'm really glad to visit this institution because it's in line with what was really I thought we should focus because it has been since I became Director General, it has been a concern to me, a serious issue because it's a problem in many countries and here the gap is really huge. So I'm really glad to see even in our own continent, especially in my own country, Sudan, that you're thinking really big. And I commend you for that, and I commend the President also for this. And as you said, glad to hear that he's the patron, actually. And I'm glad that I raised an issue of human resource. That's when he started telling me more, and then he ended up suggesting, okay, you should visit now. Then on, starting maybe from the collaborating center, many of the WHO's collaborating centers are in the high-income countries. And this is because of our own problem. We don't think that we can do things here in our continent. Mandela was flying from West Africa to Ethiopia, from a country somewhere. I don't know if you read his book, Walk to Freedom. And then when he was flying, in the middle of the flight, he knew that the pilots were black and they're Ethiopians. And then he couldn't believe it. How come a black person? And he was flying comfortably. As soon as he knew that the pilots are Ethiopians, means he's from his own continent, black people, he became nervous. Then he was actually telling his own, what do you call it, weaknesses. If we're not confident, we even ourselves undermine ourselves. And that's it. And this has to stop, to be honest. Many good things can happen here. And that's how we should see it. And on this collaborating center, to be honest, what you have done, from what you told me, is really good enough, and which could be a lesson for others. Even when I was health minister, I was focused on human resources. And from what you told me, I can see how this is different from many countries I visited in our continent. A very practical one, and that can be applied in many countries. Having a collaborating center in the US doesn't help, because something that they do that there cannot be applied to a country in Africa. But a collaborating center in Sudan, something you do well here, will be applied maybe in Equatorial Guinea. The president was coming from there, that's why I said Equatorial. Or it could be in Senegal, or anywhere. So I will speed up the, I think she's committed from what I heard, and we will speed it up. But one thing I will maybe ask Naima is, she's very dynamic by the way, to state a timeline and let's do it within that. Then we will tell the people who are going to assess this, give us time. You know, if it's 1 month, they should we should complete within 1 month. If it's 2 months, it's 2 months. If it's 6 months, within 6 months it has to be completed. And they ask whatever questions you have. But for me,
That's what it does.
yes, for me, I want to see this becoming a collaborating center very soon, because it's applicable to the major problems you see in our continent. Having a very completely different setup in the high-income countries is not helpful for Africa. And the major health problems and disease burden is in Africa, actually. And the major resource gaps are in Africa. And that's why what you do here can be applied in other countries. And that's why as a collaborating center, you could help others. So I fully commit on this, and we will speed it up. Then your focus, I mean, decentralizing family medicine is very important. Because I have already seen the plan. They were presenting to me yesterday. The family health units.
I'm just telling him to the Akbar.
And the centers, family health units and family health centers, 5,000, 10,000. If possible, even the 5,000, you want to do family physicians. But let's start even with the 10,000 or even 20,000. You will need lots of family physicians. So decentralizing it important. But some people get worried when decentralizing comes. They think that it can undermine the quality. No, I don't think so. You can consider what you should do in order to keep good quality also. So that's a very good approach, and we would be happy to help on that. But it's in line also with what we're advocating now. Although we're saying universal health coverage, the focus should be on primary health care. But one thing I would like to stress here is when you train your family physicians, very strong emphasis should be given on health promotion, disease prevention, and then of course the early diagnosis and treatment. In many countries I visited, they have primary health care, but more focused on early diagnosis and treatment, on curative services than the promotive and preventive services. So that would be one thing I know you're considering, but maybe if you give it serious attention, I would really appreciate it. And then the strategies you have followed, I mean, I enjoyed them actually. The governance, tailoring whatever you have based on, or your needs based on your health needs, tailoring the outcome, and then the decentralization, and especially from provision to supervision and accreditation. That can give you more, to achieve more in a short period. You reminded me actually of, you can, with those combination of strategies, you can keep the speed and the volume, and of course you can keep the quality too. You can move fast, and you can also achieve big, because the gap is big, and you need to train more. You need the volume too. So I'm really happy by what I have seen. Not only accreditation for the sake of accreditation, we would be happy to use your experience and like what you're doing to expand it even more as best practice to other countries. So thank you, shukran jazilan. I'm very, very happy I visited. Yeah, Masagnalo. Do you have links with the cardiac center, Salam? Cardiac center?
Yes, yes.
Training sites.
Training sites.
We want to combine.
I was impressed there.
Residents,
Yeah.
cardiology, anesthesia, and now nursing.
Okay.
And surgery, cardiac surgery.
Yeah. And I was really impressed because the outcome of their intervention is like high-income countries, the quality, high quality, good quality, and it's free. So, and they were telling me about the principles they follow: equality, equality, and social responsibility. And the way they're maintaining the hospital is also very, very good. And we were even discussing with His Excellency the Prime Minister, Mutaz, that not only the medical training, it can be used also for hospital management or health service management training. It can be used, the facility.
We have used it
But
with
I'm
the
glad.
Ministry of Health.
Yeah, I'm glad that you're already using it. And anyway, I'm really thankful and look forward to working with you closely and want to see this becoming our collaborating center as soon as possible. Inshallah.
Inshallah. These are some of our documentations we will leave with. So it has been.
الوزير
الوزير أنا حاسة